Hello everyone. Back to my YouTube channel. So today we are going to discuss a very important topic that is like the odontogenic cyst. In many cases, questions are asked in ADAT exam in oral diagnosis. So we have to see the X-ray and read age group, and the location of cyst they are talking about, and how radiographically it look. Is it between the teeth? Is it within the impacted tooth area? So let's see, discuss some of the odontogenic cysts. So first of all, the odontogenic cysts are radicular cysts. Then we have dentigerous cyst, lateral periodontal cyst, gingival cyst of adult, and then we have gingival cyst of newborn, primordial cyst, and KCOT, keratocyst odontogenic tumor. And so it is a tumor which is associated with the cyst. So first of all, let's go with the radicular cyst. This is the most common periapical cyst. So we will see the radiolucency at the apex, and it is always associated with the non-vital tooth. So you have to look in the question, the case study, if it is given that is it a vital tooth or non-vital. They can say okay, periapical inflammation from so long, and we can see the radiolucency, and tooth is not responding to the pulp testing, so it is non-vital. And in acute it is abscess, and chronic we have granuloma. And radicular cyst originates from the epithelial rest of molasses, that is from the Hertwig epithelial root sheet. And treatment is RCT, epigotomy, or extraction with curettage. Curettage is done, so we extract the tooth and then curettage to see or okay, any lining is not left. Okay, so we have second one, dentigerous cyst. So it is many times this question is asked, if in erupting teeth in children, then it is eruption cyst. And if the cyst which is like okay, there is a tooth and around the CEJ of the impacted tooth. So this is, if I say this is the impacted, so this is the tooth, and it is impacted, and it will be in the impacted tooth like this around the CAG, then it will be a dentigerous cyst. So most commonly impacted teeth are canines and third molar, so it is seen there. And it is like the uh, in case of radicular cyst, I forget to mention, so there is a like there will be like crown, and in the reduced epithelium there is accumulation of fluid, so it can lead to formation of radicular cyst. Then we have lateral periodontal cyst, which is seen in the premolar region. I want you guys to remember all the locations like where the cysts are seen. So mostly in the question they will give okay, in the mandibular premolar region it is a cyst is there. And remember, it is associated with the vital teeth. So you can differentiate between radicular cyst and the lateral periodontal cyst because it is associated with the vital teeth. And mostly radicular cyst is at the apex, so this is also another difference. Then we have gingival cyst of adult. So in this cyst there will not be any radiolucency. So if there is no radiolucency, so it is not seen in the x-ray, so it will be seen in the soft tissue, so it is a gingival cyst of adult. And there is one more cyst, that is gingival cyst of newborn. It is divided into two types, brown nodules and Epstein pearls. Remember, when the Bohn, Bohn nodules are seen in the lateral palate, whereas Epstein pearl it is in the midline of the palate. So this is a very important to remember where they are seen, and they are originated from rest of dental lamina. And there is one more cyst, that is primordial cyst, which where the tooth have formed, like where there should be tooth but there is a cyst, so it is a primordial. It is seen in mandibular third molar region. And a very important thing, that is KCOT, which is we seen like a tumor or a which is we have multiple or odontogenic odontogenic cyst. It is also called as KCOT. It is very aggressive and recurrent. Mostly the question is asked like okay, they will give you like other oral pathology lesion and see which one is like more reoccurring in case of reoccurrence and aggressiveness. So this cyst, like odontogenic cyst, is at the top. So, and it is seen in the posterior ascending ramus of the mandible. And the syndrome, which is very very important and asked multiple time, you must know which syndrome is associated with KCOT and when what other things are seen in the syndrome. So the syndrome is the Golin syndrome, and also known as nevoid basal cell carcinoma syndrome. And the other various things seen are multiple keratocyst, multiple basal cell carcinoma, calcified fox cerebri. It is very fatal. So if like this the question is asked, like okay, these things are given, and they can ask you the syndrome, then it is Golden syndrome. And in other way they can ask, okay, in the Golden syndrome what else is seen? So it will be multiple keratosis. You must know all the things seen. So these are very very important. In order to like differentiate one cyst from another, one thing we must know, okay, their normal location, and like they are associated with a vital impacted tooth or not. And it will help you. And other thing which is asked usually in the, I think, anatomy section, where they usually arise. Like they will give, okay, radicular cyst, from where it is rising from. Is it from epithelial rest of melasage or rest of the dental lamina? So it is a very very important. You might get one or two questions from this area. And if you want to focus more, you can read about them like from oral pathology, but I think it is more than sufficient to like if you will receive question, you must know the basics and you will be able to answer. Thank you, and please subscribe my channel. And you can also let me know which topic you want me to focus more so I can make more videos. I'm very thankful to all of you for subscribing my channel. Thank you.